So we have just completed the AfricaSan ministers meeting, and of course there are various partners who have attended this meeting here in Dakar, Senegal. We have made the Ngor Declaration 2015, and certainly as Africa we are not doing well when it comes to sanitation and hygiene. Various efforts have been made and we have seen an improvement, but we are not yet where we want to be because of the 27 countries where open defecation is highest. It's reported that 19 are actually in Africa, and this is a bit unfortunate, and this is why we hope that with this Ngor Declaration, various governments, various states will be able to prioritize on sanitation and hygiene, because a lot of resources are actually being spent on treating diseases related to poor hygiene and sanitation. For example, in Uganda alone, poor hygiene and sanitation costs us close to 389 billion shillings annually. And of course, this is not small money. But when it comes to prioritizing and putting resources to promote hygiene and sanitation, there's almost nothing. So government spends money to treat, but when it comes to promoting hygiene and sanitation, there are no resources. And this is something that we have to actually look at. So this Ngor Declaration appeals to governments to actually prioritize hygiene and sanitation and ensure that adequate resources are provided so that we can have adequate staff at the central government, at the district level, and of course, these people cannot work in isolation. We need resources to actually promote hygiene and sanitation and bring on board the various religious leaders, the cultural leaders, and we have seen countries like Rwanda that have made progress have actually had performance contracts with the district leaders. So this is something that we, of course, intend to pick up as a country, and of course also ensuring that we engage the community more into hygiene, promoting hygiene and sanitation, so that we can end this open defecation, which is simple to end, but a lot needs to be done in terms of advocacy, in terms of sensitizing the population, and also engaging our political leaders, because they are often shy. When it comes to talking about open defecation, there are very few leaders who actually want to talk about it. And this is something that we must do to ensure that the political leaders at all levels engage in this, become advocates, and ensure that we implement the various policies. We also need to strengthen our laws that are in place. The Public Health Act may be a little weak. So we need to work and ensure that we strengthen this. And of course, we've been encouraging the districts to come up with ordinances. A good number of districts have done this, but there are still many more that have actually not prioritized this. So we need to actually invest in sanitation and hygiene so that we can reduce on the various expenditures on treatment of diseases related to poor hygiene and sanitation. So every investment, single dollar invested in hygiene and sanitation actually brings in close to $6 as a benefit. So that is a gain to the country. And as the Minister of State for Primary Health Care, I'm going to champion this to ensure that we have Uganda as open defecation free.